Hello, everybody. My name is Benjamin Lee. Welcome to my presentation. The title of my work is FS-MSA, Few-Shot Self-Prompting Parameter-Efficient Medical Segment Anything for Aiding Brain Tumor Diagnosis. A little bit about me. So I'm a rising senior from Melbourne High School, New Jersey. I'm the co-president of the Computer Science Club, as well as the founder of the Innovative Development Club. I'm very passionate about research at the intersection of computer science, health, and the environment. I've done research in zoonotic disease prediction, harmful algal bloom detection, and brain tumor segmentation, the last of which I will be discussing in this presentation. I've received several distinctions for my works, in particular awards at different conferences as well as symposiums. I also volunteer in my community, so I work as a project coordinator for the Earth Keepers program and Jersey Cares. I've also developed an app for them, and I also teach underprivileged children programming and computer science principles. And lastly, I enjoy writing, running, and hiking in my free time. So before I get into the details of my study, let's talk a little bit about brain tumors. They're some of the most prevalent and dangerous cancers, not only because of their high mortality rate, but also because they often cause significant damage down the line in terms of neurological and intellectual function. And this is especially the later the diagnosis occurs. And also, brain tumors have a great impact on children as they kill the most children out of any cancer, despite less awareness surrounding them compared to a cancer like leukemia. And finally, the global radiologist shortage, which is occurring right now, is exacerbating issues. And the reason why the global radiologist shortage is so critical is that the typical brain tumor diagnosis requires meticulous precision and attention to detail, which I will demonstrate in the next slide. And this results in high cost, error prone, and time consuming processes. So there's been increasing interest in applying these automated models like machine learning in order to promote non-invasive detection of these tumors. And they typically rely on architecture such as UNet. So we have different models like NNUNet, SwinUnit-R. And in these two figures below, this is one slice of a brain tumor and the brain volume. And each radiologist must segment each one of these tumors, which is extremely time consuming considering there are hundreds of these slices for each patient. The issue with these automated approaches is that they rely on significant amounts of data, and data in the medical field is not very is not very easy to get because of privacy concerns and time-consuming labeling processes. This leads to my study. So my study is called FS-MSA, Few-Shot Self-Prompting Parameter-Efficient Medical Segment Anything. And the first part is that I will describe what it is. The second is that I will compare it with existing approaches. The third is that I will describe the web application I developed for it. And the fourth is that I will show you the software that I developed for it to 3D print. So I mentioned three main parts. What does this mean? So few-shot refers to scenarios where the data is limited. So in particular, I tackle this limited data scenario through two main methods. Firstly, I adapt this model called Segment Anything, which is a model in computer vision that is rising in popularity. And the second is that I incorporate multimodal input and also use different algorithms, different novel algorithms to add 3D awareness to the model predictions. The second is that I incorporate what's known as self-prompting. And even though a lot of these algorithms say that they are automatic, they're not, some of them are not actually fully automatic, and they still may require prompts, especially when they're with segment anything. And as a result, I incorporate an object detection algorithm to kind of tell the algorithm where to look for when it's segmenting things. And I will also want to discuss the parameter efficient aspect of this algorithm. So a lot of these algorithms that exist, especially UNet-based algorithms, they're very heavy in terms of parameter size. So I use LoRA, which is low rank adaptation for large language models, in order to reduce the training load and make the algorithm available to people regardless of hardware, essentially. So I mentioned that I would be doing a few results and comparisons earlier. So here they are. FS-MSA achieves the highest dice coefficient as well as the second lowest trainable parameter space, which indicates that it's very efficient. It can be run on a wide range of hardware, and it's also the most accurate in terms of segmentation. And also qualitatively, you can see the predicted version of the FS-MSA tumor is much closer to the ground truth compared to these other algorithms. And this web application that I mentioned earlier, The significance of this is that when I was doing the research, I was very surprised to find that very few algorithms exist that are very easily usable and accessible by non-computer scientists. And I think that this web application that I developed could make visualizing tumors and education about brain cancer much more accessible for the general public. And finally, I also did 3D printing. So on the left, you can see there's a sample brain volume as well as its corresponding segmentation mask. And the reason why I decided to pursue 3D printing was because 3D printing is often an important step in bridging the gap between the software and the clinical side. And this is for informing different surgical or radiological types of approaches when trying to treat the cancer. So why is this algorithm important? So it represents a new state-of-the-art approach in terms of few-shot brain tumor tasks, and it has extreme life-saving potential, especially when the data is limited, which is a very common scenario, especially in underprivileged areas. And this free web application that I developed could be made available to patients and healthcare providers anywhere in the world. And this is extremely important because nowadays a lot of algorithms take GPUs that may be thousands of dollars to buy, and this is simply not feasible for many people. And then finally, the 3D printing algorithm may may bridge the gap between the software and the clinical side, and it may help influence and inform clinical decisions. And in terms of future research, I hope to expand this approach beyond brain tumor segmentation. There are a lot of different fields that could benefit from such an algorithm that can perform well under few-shot circumstances. Here are my references. And I would like to acknowledge this research was conducted independently without the help of any mentors, but I would like to thank my teacher, Mr. Cook, for providing advice on organizing information. And here's my contact information. Thank you.